Hey guys, Dr. BenGalyardt here at the Functional Medicine Center, and today I want to go over something that we see all the time with patients and a lot of people are confused on, and they don't really get what the difference is when we look at blood work versus their primary care doctor or their traditional medical doctor is looking at. And the big difference that we see is the ranges. The ranges are going to be different because in the traditional lab range, and in our part of the country, we have 4 or 5 main labs that people will use. And you know what? Almost every single one of those ranges for the same marker, like vitamin D, could be different. So for some labs, the low end is 22, some is 24, some is 26, some are 30, and the upper end range is going to be different as well. So why is there that difference? That's the first thing that we look at, is why are there differences? Why aren't there set standards for what those ranges should be? And it's based off of statistics. And if any of you remember statistics, definitely was not my favorite math class. I really liked math, but statistics was not it. But if this recognizes here what you've learned in the past, this is a bell curve. And bell curves are based off of the whole populace that the statistics are looking at. So for that specific lab, they're looking at this range and they have outliers, and those are called standard deviations. And so you might have 1 or 2 or 3 standard deviations off there, but really they look at that middle range here, and it's about that 90% of the people that come in to the lab. And that 90% is going to be okay in that lab range. And guess what? 70% of the population is overweight or obese. There's no way that there's 90% of the population that is healthy. So we know that has nothing to do with health. All that has to do with is averages of people that go to that lab. So what we go off of in our functional medicine range is this narrowed range here, and this is going to be that functional medicine range, and it's going to be based off of what researchers have found healthy people should be. So the healthy range in this functional medicine range is going to be a lot more narrowed. We're going to be able to find things that most labs aren't going to find, most docs aren't going to find. So I'll use vitamin D as that example. And a lot of labs are going to say 30 to 100. That's pretty much the average of all the labs that we look at. 30 to 100 is a pretty good, okay range for vitamin D. But guess what? Our functional healthy range is going to be 60 to 80 is going to be that optimal range. If somebody has autoimmune, Hashimoto's, lupus, RA, any of those things, they need to be up at least at 80. So here's where it really gets tricky for people, is they might be at 30.1 and their doctor says, oh, you're fine. The next day they're at 29.9 and then it's too low. So guess what? It doesn't really matter. You're low no matter what. And so we've got this big gray area. We see people come in all the time, 32, 31, 34, and they may have autoimmune condition, and it's got to get this far to get to that optimal range, to get to that place where we know they need the health to get that up to where it needs to be. So that vitamin D, 30 to 100 is that typical range. 60 to 80 is our optimal range for what healthy people should be. And there's this big gray area here, and in our blood work we've got red, yellow, and green when it prints out. If it's outside of the lab range, that'll even be red. If it's inside of our good range, that'll be green. If it's in this yellow range, that's kind of that gray area again. It's not healthy, but it's not like overtly, oh my gosh, this is emergency, we've got to do things. So when we start thinking about the functional medicine range for blood work, we look at that optimal, where should healthy people be? This is one of the big reasons why we're able to pull things out as far as thyroid goes when most doctors are not seeing that. Our TSH range, so TSH, thyroid stimulating hormone, is 1.8 to 3. What's the traditional typical lab range? Well, it varies a lot, but typically it's going to be about 0.2 all the way up to 5 to 5.5, depending on which lab you're going to. That is a huge range. That is a major difference, and where people that have serious imbalances, they're going to fall into that normal range. And so that's not giving us the information we need. So sure, we're going to use these numbers occasionally, and we're going to look for these outliers, and that's going to tell us, oh wow, there's a major thing. Somebody's got diabetes, we need to look into cancer, we need to look into, they have severe anemia, some things like that. But most of what we're going to be finding is in this functional medicine range, and that's why people almost every single day cry at the reported findings when I sit down, show them the blood work, and say, there truly is something going on with you. Why? Because they've been told over and over and over again that they are looking at the blood work, and you know what, everything's in pretty good range. Maybe eat better, lose weight, or maybe it's all in your head, or maybe we should see a psychologist or get on some type of a anxiety medication. Any of those things, those are not going to fix the why. And that's what functional medicine is all about. We've got to fix the underlying why. We've got to fix why the body is out of balance. And let's say fertility even. We're just working with a couple recently that's dealing with fertility issues. And there is no fertility protocol that we give people. But what we do is we look at the mother and the father, and we get both of their health to that optimized level and get them to a point where they're able to conceive and able to have that pregnancy and have that baby that they want. Not because we give them, oh, here's a bunch of herbs that get somebody pregnant. That won't work. And long term, the odds of that being a consistent thing to help people is not going to be constructive. Because we think about, why couldn't a couple get pregnant? Well, there's got to be some underlying imbalances. There's got to be some things where it's just not working like it should. And so that's where we come in. No matter what the condition is, no matter what the issue is, we can fix the underlying imbalances. I was training a doctor recently, and that doctor was feeling comfortable working with a certain type of patient and not really wanting to get outside of that process. But you know what? I talked to that doctor and we worked through, and I showed them how we can work with any type of patient, no matter what the diagnosis is. And that's the great part with functional medicine, is we don't have to specialize in any one thing. We specialize in fixing the body. So even if we do a lot of thyroid work or a lot of autoimmune work or blood sugar work or anything like that as far as a patient diagnosis goes, it doesn't matter, because we're going to fix whatever that underlying why is, and we're going to look at these ranges, and we're going to say, you know what, whatever is out of balance in that person that's been diagnosed with X, Y, or Z, we're going to work A, B, C, D, E, and F, no matter what that diagnosis is. And that's the fun part about doing the functional medicine piece, because we don't have to guess. We don't have to just throw somebody on a program that is a redundancy to the last 10 people that came in. Because here's the deal, we have patients with Hashimoto's, autoimmune thyroid. Some of them, guess what, they've got bacterial infections. The next person might have viral infection. The next person might be anemic, where the next person might have excess iron. Somebody might have high blood sugar. Somebody might have low blood sugar. Somebody might have both, swinging high and low. And somebody's got fatty liver, and somebody doesn't have fatty liver. Somebody has under conversion, so it doesn't even matter if their thyroid's not working as well as it should, because they're not converting T4 to T3. So those are all the things that we have to look at, and we've got to get that in-depth, full evaluation. We look at the body neurologically and metabolically during our exam, different exam than anyone's ever had done before in their life. From there, we look at brain maps, we look at blood work, we look at all these different tests that are going to tell us a whole lot about what's going on. At that point, we're able to figure out where those imbalances are and help people. Probably 25% of our patients come from out of state, and so we are able to work remotely with a lot of patients, a lot of different places, and we don't have to come continually back into the office. For those of you that are local, we're able to do a lot of different things in office, take people by the hand and go through step by step through that process. But that really is what we're talking about. Functional medicine is an individualized program. It's an individualized process where we take you, we work with all the different people that we have in our office. We're able to manage medications. We're able to do the nutritional side, supplementation side. If there's structural imbalances, if there's need for therapy, for brain work, whatever it is, we're able to support those, and we get that person healing over and over and over again. Traditionally, our Facebook voucher is a $97, and that includes the brain map, that includes the blood work, that includes that exam, and the chance to sit down and have me explain what's going on, and that chance to actually cry. And we see it all the time, because I will give you those answers, and I will give you that information that you truly need to know that your body can heal, and it can get to that place to be able to move on to having that vitality. That is our number one goal with patients, is to increase that vitality, because I know if we can change your vitality, we're going to affect the world, because you're going to be a better spouse, a better parent, a better co-worker. All these different things are going to be different. You're going to be able to enjoy life more, and we see it every single day. Just working with a patient yesterday, he's in his 70s, came in for diabetes work. We're 5 weeks in, and he wears suspenders, thank goodness, because he's down 22 pounds. And he's like, I'm not even trying, doc. This is the easiest thing I've ever done. And his blood sugar has gone from averaging in the 190s to the 140s in 5 weeks. I always say we can reverse diabetes in as little as 6 to 8 weeks, and he will be reversed, guaranteed. Because why? He's playing the game. So that's the exciting part for me. I know that if someone takes that step, if they take the massive action, if they commit to getting their health back, we can get them to that point. And a big part of it starts with this functional medicine range. We've got to know where that functional medicine range is. We've got to know what's outside, but also this gray area. And that gray area is the crucial part for us figuring out, are there adrenal issues, are there gut issues, are there brain issues, are there liver issues, whatever it is, we've got to fix those, and we've got to help that system. So like or share this with anybody that you know that is wondering what functional medicine is. For those of you that have seen us and want to get the information out to your friends and family, go ahead and tag them below, or share this with them. We love getting this information out there. There's a revolution going on in this society, and it really is about our health. It's taking back control of our health, and it's taking that information that we gather truly from our physiology and what we can do to heal. The days of Band-Aids, the days of covering up with medications and just loading up one more pill on top of one more pill to cover up symptoms of another pill and all those things, those days are over. We need to have this paradigm shift, and for anybody out there that's looking for that, you've got to get that information out there, get them to start understanding that there is a better way, there is a better option here. So look forward to talking to all of you. Leave any questions, comments, anything below, and again, we try to make this as affordable as possible to get in, get the information. I want to know for sure we're going to be able to help you. $97 is all it takes to get all of this information and come up with a game plan for what you can do to get your health back. So make it a great day, guys.